Hello everyone. Today I'm going to talk on current trends and the future of orthopedic publication industry, relevant more to the Indian scenario as well as the global scenario. I'm Dr. Lalit Maini. I'm the editor of Indian Journal of Orthopedics and also a professor of orthopedics at Maulana Azad Medical College. So the current trends definitely are on the rise. If you look at the number of journals, the number of publications in them, specifically in orthopedics, if you do a PubMed search, you will be surprised on over 350 journals already existing on the orthopedic specialty itself. And the era has diversified further that now we have even specialty journals in orthopedics. Like you'll have at least 7 to 8 journals coming up in the hand section and a similar scenario in most of the specialty orthopedic journals. So the current trend is on the upswing, and we probably are looking at more and more increase in this. And if you look at it closer with a lens, you would come to know that around 10 publishers are holding 50% of the global literature. So it comes both with good and bad points attached to it, that there are 10 leaders, but then there are only 10 leaders who are actually dictating the global literature. And literature is full of invisible holes. If you start from the point of data to finally the healthcare policy implementation, there are invisible holes, meaning that the facts are there, but then they might not be visible. Few of the outshoots of that particular scenario is that we do have predatory journals, we do have profitability entering into the publication world, we have evolving publication and business models. We have different types of platforms cropping up, especially something very peculiar which has come up recently, the preprint platform. So for sure, medical literature, also orthopedic literature, is getting digital. Libraries, the physical formats are shrinking, and everybody is actually now carrying a library in his pocket, in his smartphone, or any digital platform. So this is one real current scenario which nobody can deny. The reading and learning habits and the access of literature has dramatically changed over the last decade or so. Future trends, we are sure that technology is really knocking hard. It is changing the way we look at literature. It is changing the way we are accumulating literature. And it is going to change a lot of ways which we couldn't have believed maybe 50 years from now. So let's see how. Data. A big data, which is volume data, velocity data, and variety data, meaning that this is the one big thing which is making a change when it joins hands with artificial intelligence and various types of engineering expertise which the computer holds. The second part, the data, more so we've understood in the COVID era, we need to respect data, and that is the first building block of any medical literature or research. The negative publications getting respect through COVID has made the researchers realize the importance of transparency and respectability of every data which is going into the world of medical literature. So this is one new understanding and big change which is going to be there in the future. Are journals too slow? Few decades from now, it was thought that the textbook literature is at least 5 to 6 years behind the existing knowledge. And then came in the journals, which it was thought keep you abreast with the latest. However, again, COVID made us realize that the journals again are at least 5 to 6 months away from what is known to the world. And is born the new platform of social media which brings in Twitter, which brings in blogs, which brings in LinkedIn, which brings in all sorts of social platforms, which allow the researcher to disseminate any knowledge gained, whether positive or negative, which can immensely affect the health outcomes. So after big data, I think social media is a big change which is going to happen with medical publication, which is going to change the way people can access it. And I can tell you, this change has taken medical literature even into the common layman's mobile. Even everybody across the road has been searching literature, especially in the COVID era, and making sense of what is going on around. Regulations, yes, especially in our country, they are gradually settling down. Medical literature is getting regulated. CTRI is one big change, the clinical trials registry in India. Every thesis happening in every medical college in the country needs to be registered. The trial registries are becoming a serious matter, and they are also being regulated. They're being looked into. Now, timelines are shortly going to come in, especially for PhD research and other trials, meaning that there would be a closing date for a trial. It cannot happen that if you have a negative result, you just don't continue with the trial and call it a day. So regulations are coming in, and that's another big change and futuristic thing which will sort of make the respect to the data which is published even more. Open access journals, it has already entered the medical publishing world, and although it has not changed the whole scenario as it was expected, that it will really turn around the way the medical literature can be published and looked at. However, it is making some inroads into the changing behavior. It can be a gold or a green or a hybrid type of a relationship in which the article processing charges is one issue which is actually taking away the barrier of reading literature from a reader. It has its advantages, it has its disadvantages. And then the predatory journals, which actually have no definition and no defense, are another futuristic problem which we are looking at. Plagiarism, as far as each particular manuscript is concerned, now can be picked up very easily, Authenticate being a popular one. And one futuristic thing is that now even the researcher is getting an digital object identifier. He gets a number and there are various utilities to it. So the model needs change, and pharma and medical devices companies are driving the change at present. Increasing cost is being passed over to the end user, which is either the author or the researcher, and this is a fact which is on hot debate and needs to be digested. Cautious optimism exists. We are hopeful, and we are sure that the human hand and the artificial hand are going to shake hands in the future to make medical literature even more useful and sensible to give a better health to the society. So thank you very much.